Imagine being homeless. Now, imagine being homeless and having a diagnosis of HIV/AIDS. Those who are homeless have higher rates of HIV compared to those who have stable housing. The homeless tend to have poor access to health care and delay seeking treatment, but this population is vulnerable for multiple reasons. Many who are homeless lack familial and support systems, resources, and have decreased access to care. There is a large number of those who are homeless that suffer from mental illness and substance abuse, and this, along with being HIV seropositive, places a stigma upon them. These are some of the reasons why they may not utilize services or seek care due to concerns of judgment and lack of compassion by health professionals. Many feel judged for their diagnosis and assume that those who can help may place the responsibility of their health status upon them. Those who feel stigmatized avoid HIV/STD testing, delay seeking care, are reluctant to disclose their status, and not adhere to treatment. A study by Walitsky showed that perceived external HIV stigma was associated with missing HIV medication doses. Much of this population are only able to access care through emergency services. People who are homeless with HIV/AIDS have a higher utilization of emergency room visits versus those who are stably housed. Utilizing emergency services versus access to a primary care provider places a barrier on long-term disease treatment and decreases the likelihood of antiretroviral adherence. Treatment of HIV/AIDS requires a specific cocktail of medications to suppress viral loads and maintain overall health. Lack of stable housing leaves people without the ability to secure employment and health insurance, which would enable them to address a complex disease such as HIV/AIDS. According to a study by Thakar, a greater number of the homeless population are HIV seropositive in comparison to those who have stable housing. More recently, the CDC found that of the 1.2 million individuals that are estimated to be HIV positive in the United States, only 30% are virally suppressed. The homeless have lower CD4 cell counts and higher HIV viral loads. Lack of housing alone is a predictable barrier to receiving consistent antiretroviral therapy. Overall, the worse the housing situation is for this population, the worse the health outcomes are, which includes an increased risk of premature mortality. A systematic review published in the American Journal of Public Health found that being homeless with an AIDS diagnosis significantly increased the risk of death over a 5-year period. Conversely, those who obtain supportive housing lowered that risk. There are increased risk behaviors in those who are homeless. Simply looking for your next meal and somewhere to live can lead someone to make decisions that put them at risk. Such behaviors include sex with partners whose status is unknown, condomless sex, exchanging sex for money, drugs, food, or even a place to stay. These behaviors decrease personal safety and increase the risk of HIV transmission. Studies show that people living with HIV/AIDS who are homeless are more likely to have antiretroviral resistant HIV mutations. There is a greater risk of transmitting drug-resistant HIV because of the rates of unprotected sex and detectable viral loads with drug-resistant HIV. According to Duchesne and Anderson, many homeless are willing to seek care when they perceive their health condition to be serious. However, with this population, many factors impact their access to adequate care and disease treatment. Misconceptions by the public regarding disease transmission and fear of casual contagion only feed into the stigma. Multiple layers of stigma exist for this group, including race and ethnicity, gender, age, and sexual orientation. Addressing these misconceptions and educating the public about the struggle of this group could help in decreasing stigmas. Recognizing the importance of stable housing for those with an HIV/AIDS diagnosis will help to improve antiretroviral utilization and decrease the rates of transmission, all while subtly improving the quality of life for this population.